Thanks for having me. I'm going to present on tips for better choices. I'll just start off with a little bit about who I am. I have a master's degree in biomedical engineering, and I'm a registered patent agent. I'm also a serial entrepreneur. I've designed spinal implants. I've worked on neurological stimulators. I've worked on heart pumps. I'm the owner of a database company, ISP Mansis. I'm a partner in Fast Speech Therapy, which was a recent winner in the New Jersey Technology Life Sciences Innovation Competition. I'm the owner of Annett Enterprises, which is a boutique engineering design firm. And I'm also chief product and vision guy for snackbuilder.com, which was the winner of the Lean Startup Machine. And if you came for that presentation, I'll be happy to do it afterwards. But I was asked by Carlos to focus on my TIPS company for this one. So what is TIPS? TIPS stands for Timely Interventions for People, Places, and Situations. And say you're a diabetic and you arrive at Rita's Italian Ice. What you'll do is you'll get a message that says you have arrived at a location that you either want to avoid or make better choices at when there. And you can get your own tips associated with it. Maybe go down to the Veggie Hut down the street, or tips from your nutritionist, your support system, or tips that the public have provided to you. If you say no thanks, then you'll get a reminder that says, don't forget to test your blood sugar before every meal. If you're an alcoholic that's gone to a bar, maybe what it'll do is after 5 minutes, it'll call and notify your AA sponsor that you're at a location that you don't want to be at. It's all about interventions for people who want to make better choices in their life. Another big, besides substance abusers, is gambling addicted. And this one is actually really important. There's a quote from Donald Weinbaum, who's the executive director of the Council on Competitive Gambling here in New Jersey. And he's actually really excited about being a pilot site for TIPS. And because for people who are gamblers, you can self-register with the casinos, and they will escort you out when you've arrived, and they know when they see you there. If you show up to buy a lottery ticket, and with this last Powerball, there's nothing except for tips. So if you arrive at a location that sells a lottery ticket, you can get a notification. Do not buy the lottery ticket, and a reminder. And maybe it'll flash a video in terms of show your kids, and what you're doing in terms of taking away their college education. How we'll make money? And just because I was talking about compulsive gamblers, I'll kind of walk you through this scenario. There's approximately 12.5 million people that suffer from compulsive gambling. If we get a 10% market share, that's 1.25 million people. One option is to sell the app. If we sell the app for $1, we'll get $1.25 million, but then nothing really ongoing revenue. So that's really not a good model. What we want to do is we want to give the app away for free and charge $1 per month to support providers, to the person's psychiatrist, to the person's nutritionist, to find out how they're doing in between visits. And if we get 10% of the 10% to actually have support providers paying $1 a month, that actually ends up being $1.5 million annually. If we get 20% of the users, it goes up to $3 million. If we get 50% of the users, it's $7.5 million. Okay? Now you might say 50% of the users is awfully ambitious. The truth is, though, most people that are actually in crisis and trying to get better have multiple support providers. So they might have their psychiatrist working with them, their substance abuse counselor, nutritionist, different people that are working with them. So each one, going forward, we're actually just projecting a 20%. Okay, so 20% of the 10% going forward. Just to pick another population, people with diabetes, there's roughly 26 million people with children and adults with diabetes. 19 million are diagnosed. There's roughly 80 million people that are pre-diabetics. And if you look at a 10% market share with 20% doing it, that ends up being $4.25 million annually, additionally from adding diagnosed diabetics. The pre-diabetics are a big money, and this is actually probably the most important market, because if you can intervene with these people and teach them good behaviors, you can stop them from becoming a diagnosed diabetic. And there we're talking $19 million annually. If you look we can safely project that we can get to about $50 million annually just by adding on additional diagnoses and building a market for each one of them. And that's not even counting targeting people with like food allergies. So if you're allergic to peanuts and you show up at a restaurant, you'll get a prompt that this place has peanuts. Okay, so anything that you need therapeutically in intervention based on people, places, and situations when you arrive at a location. There are a couple competing systems. There are some generic location-based messaging systems like Drop and GeoNotes. And there's also a system called HS out of the University of Madison, Wisconsin. And all three of these have three major deficiencies, and it's predominantly because they're using geofencing and traditional geofencing. And the way that works is your GPS location is constantly being sent to a server. And the server looks if you're within the boundary of a location. And that costs so much money, not only in terms of data transfer, but they just suck the life out of your battery. So it's a big expense in terms of that. Privacy is a real big issue. If I'm a sexual predator and I want to be reminded to stay away from a certain elementary school, okay, I would be terrified as hell if I knew that my location was being tracked constantly on a server. Okay, so we're actually not doing this. The other thing is because of these systems use these generic services that they're not HIPAA compliant. In terms of the assets that TIPS owns, we own a couple of URLs. T for BC is the one that we would use. We're patent pending for a system and method of providing therapeutic interventions based on both public and private location-based messaging services. And what the difference is between us and the systems that are out there is we actually base it upon arrival. So the geofencing that's out there, if I'm an alcoholic driving past a bar, I don't need a message that you're passing a bar, don't stop. Okay? It's only when I've arrived at the location should it look and find out if I'm in a trouble spot. And that's the difference between our system. What we're looking for additional team members, a CFO, development people, additional project team manager, tech partners, and actually university partners that we mentioned because we want to go for an SBIR grant, which is a Small Business Innovation Research Grant. We need about $150,000 to get us through the pilot funding. Again, as we pursue the grant, that can be up to $1 million in years 2 and 3 if we do that. But anyway, if we had an additional $100K, that'll get us through the system. That's my contact information, and I'm being waived.
All right. Thank you very much, Mark. That was a very unique product. Now we're going to open it up for questions and answers. Anybody questions?
Hi, thank you for your presentation. Your revenue is from service providers, healthcare providers, say I'm a social worker. So I would be paying you on a monthly basis so I can keep tabs, for lack of a better term, on my client. What is my motivation for doing that? Is that something insurance is going to reimburse me for?
Well, most of the motivation is you're seeing your client maybe once a month. What's happening the rest of the time, the rest of the month? How are they doing? This is an in-between intervention service where you can find out how they're doing. And there are ways of doing putting survey information and adding crisis information in terms of that I didn't show in terms of the system because I only had 7 minutes. But that's the input.
If I made the second part was, have you actually gone to talk with that social worker and found those people motivated to say, yes, I would pay for this?
Yeah, we're one of the big sponsors, and actually I got into this by writing a grant for NJAMA, which is the New Jersey Association of Mental Health and Addiction Agencies, and they've actually got pilot agencies already lined up that are willing to pilot once it's ready. So,
is there any research to tell you when people receive such a message whether they care at all?
Yes, there is, and a lot of that comes from the HS system, the one out of Madison, Wisconsin. They're doing a similar thing. They found good results in terms of the impact of this device. And I don't have the numbers.
Okay.
Legal service do 3/4 of this already. The ones that the new services.
Well, he's going to come up later on, and he can. He can present. If he does, hopefully I'm ahead of him with my patent. So that's a...
A lot of Google Docs. Back there?
How are you going to find and load the data about the locations that people arrive at?
Well, some of it will be like all of the lottery locations. That's already out there. Restaurants and stuff like that. A lot of the information will be people putting in also their local tips. So they know about their local spots that are the problem, and them agreeing to, and then being willing to share that for somebody else.
Back there?
Is this a native app or is this a web-based application? What's it built on?
It's a native app with a server-based component, also for the public tips, for the public information.
Users going to have to go to the app every time they arrive someplace?
The app will it'll actually do the prompts automatically upon arrival if they're at a trouble spot.
Like a push notification?
Yeah, push notification.
In the orange?
You said that the big difference between you and your competitors is that they use geolocation fencing, right? So if you're not doing that, how are you tracking their location?
I'm not using geofencing. I'm using cluster analysis to determine arrival at a location. So I don't have time to explain what cluster analysis does.
Is there a special message if you go to some place that sells ice cream, peanuts, lottery tickets, and booze?
Come party! Come party! No. Whippy!
I want that notification.
Sends it to all your friends.
Anybody else?
Anybody? Okay. Oh, wait. You sure? Okay. Well, thank you very much.
Thanks.